Hello, I am Dr. Jose Espinosa, and I will try to bring out some of the problems involved with contraception. Two stories call to mind the complexity of the problem. A German man went to a hospital to have an operation. The day prior to surgery, the anesthesiologist always goes to visit the patient to ask what kind of medication the patient is taking, if any. The gentleman told the anesthesiologist that he had been taking the birth control pill. Interestingly enough, you may notice that in the birth control pill package, it has no mention that this is only for females. It only says that it should be taken at a certain time of the menstrual period. So what this German gentleman used to do is ask his wife when her period started, then count 5 days and start to take his pills. He was surprised by the fact that after 6 years of marriage, he had 4 children. But then somebody told him that the birth control pill doesn't always work. In an underdeveloped country such as Spain, the technology not being that advanced, they used a more natural method, and that involves orange juice. The taking of orange juice at bedtime solves the population problem. What you have to do with the orange juice is not take it before or after, but instead of. I have created this presentation to bring out the facts of what I want to know about birth control. One of my questions is, why are they lying to women? We'll see from the presentation of anatomy that here we have the vagina where the sperm is deposited, has to swim into this area, through the uterus, into the tube. If ovulation had taken place, the fimbriated end of the tube has caught the ovum, the egg, which travels into this area. And approximately here, conception takes place. The developing individual has to travel into the uterus to continue growing. That process is called nidation. We can stop this process here with the mechanical methods, or here with tubal ligation, another mechanical method. We can take hormones as the birth control pill, which, number one, stop ovulation, also work at the level of the neck of the womb by making the mucus of the neck of the womb firmer so that the sperm has a harder time going into the uterus. The birth control pill also has another third function, which is to decrease the thickness of the lining of the womb, of the endometrium, which causes the early developing individual, which may have been conceived, since the birth control pill does not always stop ovulation, the endometrium will not be adequate for nidation, so that in some cases the birth control pill, especially the newer mini pills, will be causes of early abortion. We have the different methods of birth control. We have the mechanical ones: withdrawal, condom, diaphragm, tubal ligation, vasectomy, and hysterectomies, which you're all familiar with. Chemical methods, jellies, creams, foaming tablets, and douches. These try to be spermicidal, to kill the sperm. Hormonal contraception is the modern and most widespread used one. The birth control pills, the sequentials, which are now off the market, and the new mini pills. We also have injections and implants. These implants go under the skin. Some of them can last up to a year. There are another type, which are strictly abortifacients, such as the intrauterine device DES, or the day after birth control pill, and prostaglandins, which cause the emptying of the uterus when administered. Abortifacient quality of the hormones, we've spoken of. There are abortifacient qualities of the immunological methods of birth control, which is the anti-pregnancy vaccine. The natural methods of birth control involve the old, outdated calendar rhythm, the temperature method, the mucus method, and the symptothermic method. The contraceptive philosophy tries to stop humanity at the vaginal gates. The worst thing that can happen is to be pregnant. Pregnancy is a disease. People are bad. People pollute. The world is very bad. I cannot take care of a child. There are too many people already. It's a total lack of faith in God and man. We cannot solve the problems that our sexuality gives rise to, and apparently God made a mistake in creating so many people. Once you accept that you can have a contraceptive failure, then it's not too difficult to follow that with the so-called backup contraceptive abortion. To her, women's lib means children when she wants them. If we realize that the problems with the birth control pill have been well studied in England with the study by the Royal College of General Practitioners, published in The Lancet, October of 1977. By it, we found several things. Number one, a woman that had taken the pill for any period of time had a mortality rate 5 times that of the controls. And if she had taken the pill for a period of 5 years or longer, her mortality was increased by 10 times. This doubles the death rate of women from pregnancy and its complications. One of the examples of this also was published in The Lancet in 1976. It describes the case of a 20-year-old girl who had been taking the birth control pill for 2 years. She slept with her boyfriend and in the morning got up to take a bath. He stayed in bed listening to the radio. After a while, he thought that the bathroom water was running for too long a period of time. So he got up and found her drowned in the bathroom. What had happened is that she had a stroke. By a vasoconstriction of the blood vessels that go to the brain, she passed out and drowned in the water. This brings to light that the birth control pill will one day probably be removed from the market because of the complications that are taking place. Major complications of the pill, with thrombotic disorders, that's forming of clots. You can have a stroke, as we mentioned. Venous thrombosis is clot forming in the legs. As long as it stays in the legs, there's no big problem. But if it travels to the lung, you have pulmonary embolism, which is one of the causes of sudden death. Myocardial infarction is one of the big complications, especially on women who smoke. So that if a woman is taking the birth control pill, she better quit smoking or quit the pill. Hypertension is another problem. Approximately 5% of women on the pill develop a hypertension severe enough to require her discontinuing the pill. However, anybody on the pill for more than 2 to 3 years has an increased blood pressure, probably 20 millimeters of mercury. Not enough to discontinue, but it does raise the blood pressure. Post-pill amenorrhea is one of the problems which occurs in approximately 2% of pill takers who stop the pill will not have a period for periods of up to 6 months. This is one of the reasons why many women having abortions in abortion clinics may not even be pregnant, because the post-pill amenorrhea will make them believe that they are pregnant. Gallbladder disease is another problem that occurs more frequently now. There is about a 200% increase in that problem. It used to be said that to have gallstones, you needed 4 Fs. You had to be female, fat, 40, with 4 children. Now we're seeing more younger women with gallstones due to it. Hepatoma is another problem. This is a liver tumor. It's usually benign. There are 35 described in the literature, and of these 35, about 15 died because of bleeding. In other words, this tumor is not malignant, but it can rupture. Interestingly enough, discontinuation of the pill does not decrease the size of the tumor. Use in pregnancy. If the woman continues taking the pill while she's pregnant, she may have congenital anomalies of her child. Carcinoma, there is a relationship between the pill and endometrial cancer, the cancer of the lining of the womb, and of course it enhances carcinoma of the breast. Other side effects of the pill: nausea and vomiting, breakthrough bleeding, psychic depression, weight gain, alterations in menstrual flow, and disappearance of it, amenorrhea. There are breast changes, cystic disease, and fibroadenosis. These breast changes with those scientific names don't sound too upsetting. However, on young girls who are given birth control pills, the breasts develop but also age, so that I have seen 16-year-old girls who have been on the pill since age 14, and their breasts look as if they were those of a 70-year-old woman. They have become pendulous and full of lumps, and it's not nice to have that on a young girl. It also causes vaginitis. Almost 100% of the women on the pill have vaginitis, discharge from the vagina at one time or another. There's another problem, central nervous system consequences. Professor Jérôme Lejeune of the University in Paris, the discoverer of the defect that causes Down syndrome, has stressed the fact that estrogens help the brain to develop, so that we are carrying a massive experiment, since the brain does not end its development until after the teenage years. That is why I do not get too upset about teenagers. It's something that goes away with time. We do not know how it's going to affect the brains of these women. Are they going to be super smart or not? Additional conditions: lowered tolerance to contact lenses, herpes, respiratory infections, hay fever, changes in libido. In other words, you may lose part of your sexual impulse, mouth ulcers, chorea, which are spastic movements, which disappear if you discontinue the pill, and photosensitivity, which means you may not be able to go to the beach because you break out under the sunlight. Sequential oral contraceptives removed from the market. This is the road that it's going to continue, and I'm sure that all oral contraceptives will one day be discontinued. These pills, which were supposed to be better, have a higher risk of endometrial cancer, more risk of clot forming, thromboembolism, and decreased effectiveness. So there may be some viewers of this presentation that may be a result of such a pill. Here we have one of the consequences of taking the birth control pill. We have vaginitis, which causes itching, burning, and a discharge and malodor. But the same manufacturer that made the pill and charge you money for it makes suppositories and vaginal powders and topical applications and creams and suppositories to cure the condition. So they get you coming and going. We have the DES, diethylstilbestrol. That's the morning after contraceptive. It used to be used in pregnancy to prevent miscarriage. When a woman had bleeding in the first trimester of pregnancy in the 1950s, she was placed in bed and given this medicine. The children of such a woman, the DES sons, have come out with impaired fertility or genital abnormalities. The DES daughters have come out with vaginal or cervical cancer, so that these women whose mothers took the pill when they were in the uterus of their mothers, unborn yet, have a better chance of developing vaginal or cervical cancer in their teenage years. This drug is so dangerous that the Agriculture Department has discontinued its use for cows. Estrogen is a developing type of hormone, so that if you give it to a cow, you'll have more weight in a shorter period of time, so you make more money in the meat. But it's dangerous, so it's not for cows, but I can still prescribe it to women. Intrauterine devices is another form of birth control. The early ones were made of steel, then plastics came and we have the Lippis loop, one of the most popular ones, still used. The Margulis spiral, the Bingberg bow, the double coil, and a very famous one, the Dalcon shield. Approximately 2 million women had this one inserted until 43 of them died, and then it was discontinued from the market. The problem with it, of course, was infection and miscarriage. The mode of death was usually septic abortion, since the intrauterine device does not prevent conception but causes an abortion. One of the modern ones is the copper T, and the more popular one, the copper 7. Copper inside the body for a prolonged period of time has the problem that we do not know its effects, but we'll find out in due time. Complications of intrauterine device: we have spontaneous expulsion, ectopic pregnancies, a pregnancy in the tube. It may become embedded. It may create pelvic inflammatory disease. This is an infection which is 7 to 8 times more frequent on women who have intrauterine devices. The intrauterine device itself creates an inflammatory reaction inside the womb, and bacteria can settle and create more problems. Perforation is another interesting complication. One case described in the American Medical Association Journal: the intrauterine device perforated the womb and lodged in the appendix, requiring an appendectomy, removal of the appendix to cure the condition. Bleeding and pain is another problem. The mode of action, of course, is that the endometrium is made unsuitable for nidation, that is, an early abortion occurs. IUDs linked to ectopic pregnancy. Maternal deaths are also increased from that condition. A.H. Robinson Corporation faces a total of 533 lawsuits seeking over $480 million because of injuries caused by the Dalcon shield. In order to stop anybody from thinking that the contraceptive business is anti-women, there is a feeble effort to discover male contraception of finer methods. A male contraceptive pill stops spermatogenesis. A man without sperm, of course, cannot fertilize a woman. But unfortunately, these pills also stop mating behavior. So at this point, we could have the gentleman who is now sterile because of that contraceptive pill can sit next to his girlfriend, and they can both write fan letters to the fans. Ultrasound is another mechanism which stops the production of sperm by the testicle, and this is being investigated. Reversible vasectomy is being tested. There are implants that are placed under the skin, and if you turn it on, you are able to fertilize a woman, and if you turn this little gadget off, you are sterile. However, the problems with this is that the body continues to reject it, and it's being expulsed, not being tolerated. Until the early 1960s, the official position of the American Medical Association on birth control was neutral. In December 1965, the Griswold Supreme Court decision permitted contraceptive information, and the AMA followed suit. The recent stand, the AMA has endorsed sterilization and abortion. New York, United Press International, abortions performed on women who were not pregnant in one of the abortion clinics. The doctor would put me through an abortion that afternoon if I had the money. One facility told our investigator that after the abortion she would feel like a virgin again. Why get pregnant, have an abortion to feel like a virgin again if you can feel like a virgin again without all that complicated maneuvers? Some employers discriminate against women of childbearing age. At the zinc smelting division of St. Joe's Mineral Corporation in Pennsylvania, the one woman who was sterilized was allowed to return to her job. Birth control and genocide. In her book, The Pivot of Civilization, Mrs. Sanger deplored the lack of balance between the birth rate of the unfit and the fit. She wanted to cut down the rapid multiplication of the unfit and undesirable at home. In 1935, the American Birth Control League resolved to unite with the American Eugenics Society, and that is now Planned Parenthood. New York statistics, United States birth rates between 1960 and 1970 dropped as follows. Urban whites down 27%, blacks down 37%, American Indians down 45%. India, birth control vaccines are being tried which would prevent continuation of pregnancy for 9 months. This is part of contraceptive colonialism. We wouldn't try this in the United States because consumer groups would not allow it. Resistance to family limitation is greatest in rural and remote areas. A large family is needed to support aging parents. There is no Medicare there. In India, it is said that you need 6.3 children in order to be able to have someone alive when you are of retirement age. Moscow, fatherless and one-child families are on the increase. The declining birth rate has hurt this country's economy. Shortage of housing and preschool facilities, increasing divorce and poor wages. There are no young people to be able to build these houses. There will be new millions of unborn children and millions who fail to find happiness. That's a quotation from one Moscow individual. This graph shows the demographic curve which has occurred from 1800 to 1950. The death rate has gone down with the discovery of more medical technology, medical advances, hygienic advances that fights disease. Parallel to that is the birth rate curve has decreased. Now mark the parallel curves. This was before any adequate contraceptive technology, so that in 1800 there were over 35 children being born per 1,000 people. Now we have approximately in the 15th in the United States, a little below that, which happens to be below replacement level. The world's population grew by 1.9% in 1970. It fell to 1.6% in 1975. This from the World Watch Research Institute. This is a decrease in growth of 15%. The world could support a population of 40 billion, according to Scientific American. This is without any advanced technology. This is with present-day technology. However, we know that progress has not come to an end. This will allow us to maybe increase the numbers of people. This is Dr. Juan Jose Lopez Ibor. Dr. Lopez Ibor is a psychiatrist, and he has 12 children. He's a professor of psychiatry of the University of Madrid, and these are 4 of his children. They are psychiatrists. He has 3 others in medical school and 1 who is a psychologist. And I believe that what he's probably doing here is having them sign his retirement papers so that each one of them can give him 10% of their income, and he can retire in the Caribbean somewhere and just live off his children. So in this situation, he can even create a whole medical society with his children. Natural family planning is Mother Nature to the rescue. We have calendar rhythm, which is obsolete. Temperature method has been called by Dr. Tizzi of the Population Council as the most effective method of birth control. the mucus method of Billings, and the symptothermal method. These forms are called cooperative methods of birth control. They do not rely on the woman taking pills or on the man doing different things, but on both working together. This is the ovarian cycle. This is the pituitary or hypophysis. This tells the ovary to mature, and this is a follicle with an egg or ovum inside. As that develops, the pituitary sends hormones to cause ovulation, which we see here. This egg is now viable for anywhere from 12 to 24 hours to be fertilized. If there is a sperm nearby, this will occur. After ovulation takes place, the follicle becomes the corpus luteum. This is important because in the first half of the cycle we have the secretion of estrogen, and then after ovulation the corpus luteum secretes progesterone. The importance of this mechanism is that it makes for temperature changes. So in the first half of the cycle your temperature may be low. Here we have 35.5, approximately maybe 97 or so in the Fahrenheit scale. After ovulation, progesterone is secreted. That makes your temperature go up. So after there is an increase in temperature in the second half of the cycle. This part, when your temperature is off, is the basis for the temperature method of birth control. The lining of the womb also has a cycle. During menstruation it has gone down in thickness, then the estrogen makes it build up to here, and then the progesterone makes it become nutritious, so that if conception has taken place, the child will have a place to thrive here. These are vaginal cells which can also be studied to see if the woman has ovulated or not, and she'll have these shrunken little cells down at the bottom. The mucus secretion depicted here in the first half of the cycle. After menstruation, the neck of the womb is dry. At this time the woman is not able to conceive. As estrogen is being secreted, the mucus becomes fluid and in larger quantities. And coinciding with ovulation, you have what we call peak mucus, which is more stretchy, and it can stretch up to 2 inches. After that ovulation, the mucus becomes tacky or thick, and that's because of the progesterone, so that by examination of the mucus, the woman knows when she ovulated and when she's going to ovulate, so that she can stop having intercourse in this phase, quit for a few days, and then start again and not get pregnant. The temperature curve that we see here describes the changes. The temperature here is 36 and some degrees, and it goes up to almost 37 in the second half of the cycle. This is the fertile time when the temperature shifts. The mucus tells you when this is beginning, and the temperature method is the one that tells you for sure. This is a complicated chart that explains the symptothermal method. You take your temperature, you examine the womb, the neck of the womb that you can feel, or just the outside of the vagina, and see whether there is dry mucus or wet mucus, meaning possible fertility, and then mucus peak. Then the mucus becomes tacky. 4 days after the peak mucus, conception is not possible, and that is double checked when you have 3 consecutive days of temperature rise of more than 0.4 of a degree Fahrenheit, 1, 2, 3, then in this part you are absolutely infertile. There are instinctive principles for the survival of species of animal. There are changes in the environment that the animals follow. They are also aware of the presence of animals of the same species and aware of the presence of things. These principles have allowed the animal species to survive. More detailed analysis, animals, they listen to biologically relevant events, and they are ready to behave in accordance with these biologically relevant events. In other words, when it's cold, the animals fly south. When it's dark, they go to bed. Birds, for example, and that's called organic obedience. They obey the laws of nature. They also practice instinctive moderation. Together with a group is important. If there is too much infighting, they'll destroy themselves. So instinctive moderation together with a group, and also togetherness with a mate to have procreation of the species, is what contributes to the survival of the species. Together with a mate, there is no promiscuity among animals. This is called a chaste love, which is instinctive. They also practice moderation in the use and enjoyment of things. They practice instinctive poverty, which we can call respect for the ecology. They don't overeat, and they are usually not obese. They do not destroy what they do not need to use. Man is a call to transcend instinctiveness through freedom and insight. We don't have to follow our instinctiveness. We have our brain in order to modify our behavior. We can be open fully to the meaning and reality of the natural and cultural events in our life. That's called obedience. We can be respectful to self and to others, and that's called chaste love. We can be respectful to nature with the wise use of things and respect for the ecology. Poverty. This can be translated in the following. In order to respect the ecology, we should not pollute our bodies with birth control pills and other harmful things, because our internal ecology depends on not having the harmful effects of those things. Respectful presence to self and others. This chaste love means that promiscuity usually destroys society, and we can see, due to the large numbers of divorces, that there is something going wrong in our society that is destroying the family. And obedience to the natural events, practicing natural birth control may be one of the ways that we can be obedient to nature, explain its laws, find out when the woman is fertile, and by abstaining a few days, we may be able to carry on what we call an intelligent family planning. Never again in his life will a human being grow so rapidly or develop in so many directions as he does between conception and birth. His beginning is not an accident. We are the apple of the eye of the Father. If I believe that we're all brothers, it is not nice to think of others as someone's contraceptive failures. We are not anybody's failures. Each one of us is a worthy human being. And unplanned pregnancy has been bad-mouthed, and every time we think of unplanned pregnancy, we think of something terribly looking. And I'd like you to see one of my unplanned pregnancies. You decide, will the world really come to an end because she is here, or will the world not rather begin anew precisely because she is here? The so-called liberation brought by the advent of widespread contraception has created problems with it, with increased teenage suicide, increased breakdown of the family unit. Interestingly enough, we have studied the biological organs of reproduction. Some people use those organs as organs of meaningful relationship. The real drama of man is his human nature. Being faithful to our true nature, becoming neither animals nor angels, requires effort. What is truly human and natural is arrived at through reflection and self-mastery. Our efforts should not be directed towards a letting go of all restraints, nor towards a contraceptive denaturalization of the individual or of the sexual act through artificial contraception. Our efforts should be directed at promoting the humanization of sexuality through education and self-mastery. Possessive eroticism, unbridled sex, is the denial of that true human intercourse between man and woman necessary for the survival of humanity. Man and woman are complementary beings who grow by learning from each other. Ecclesiastes contains the tradition, man cannot hit on the right time to act. There is an appointed time for everything, and a time for every affair under the heavens, a time to embrace, and a time to be far from embraces. Loving continence and self-mastery lead to enhanced humanity in the married state, permitting also voluntary procreation. The drama of man, the cross of our freedom, lies in obedience to our nature, not a nature invented by promoters of amoral sex, but the nature received from our composition. This composition can be seen as a psychobiological fact or as a true call from God. Man is free only to be man. To be man is not to manipulate nature, but by discovering its laws and behaving according to that knowledge, we can reach our fullest possibilities. By renouncing our regressive egotism, we can come out of ourselves towards others and thus grow and fulfill our destiny.